Now let's talk about algorithm of BLS for infants and children. Infants are younger than 1 year of age for BLS course, excluding the newly born, and children range from 1 year of age to puberty. Here it is important to know if we have one rescuer or two. When we have one rescuer, first step is to verify scene safety, and step 2 is to check the responsiveness, additionally call for help or ask someone to get the AED. Of course, it is perfect if we can ask someone to help us, but if there are no one and we did not activate at first, we need to do chest compressions if we do not have breathing and pulse, do CPR, and then only after 2 minutes of CPR, go and call for help or activate the AED or take the infant or child with you. Third step is to assess the breathing and a pulse. Please remember the pulse check is different for infants and children. We already discussed that. If the victim is breathing normally and a pulse is felt, activate the emergency response system if not already done. Monitor the victim until emergency responders will arrive. If the victim is not breathing normally but a pulse is felt, provide rescue breathing with 1 breath every 2 to 3 seconds or 20 to 30 breaths per minute. Make sure to remember this for test every 2 to 3 seconds, 1 breath or 20 to 30 per minute. Again, assess the pulse rate for no more than 10 seconds. Here what the differences start. For babies, their heart is beating very fast, and that's normal for them. That rate is not normal for us, for adults, right? But for them, that is normal. So a rate that can be normal for an adult for adequate perfusion, maybe not enough for adequate perfusion for pediatric victims. So we need to check the heart rate. If the heart rate is less than 60 per minute, which is normal for adults but not normal for pediatric patients, and if we have with that signs of poor perfusion, we need to start CPR. So let's not forget that the patient is not breathing normally and has a pulse, and if it is higher than 60 per minute, we will continue giving rescue breaths. Check for a pulse about every 2 minutes. If no pulse, start CPR. Then we need to ask a question. Was the sudden collapse witnessed? If yes, activate the emergency response system if not already done and get the AED. If the collapse was not witnessed, start CPR with cycles of 30 to 2 breaths. Please follow all the rules actions that we learned in previous slides. For an infant, use either the 2-finger or 2-thumb encircling hand technique. For a child, use 1 or 2 hands, whatever is needed to provide compressions for adequate depth. You can see the first image shows how to do the 2-finger technique, and the second image shows how to do the 2-thumb encircling hand technique. And third image shows how to do it for a child using 1, or sometimes you can add the second hand too. And of course, if we did not activate the emergency response system and AED, we need to do that. And when AED is available, put the pads on. Again, please remember all the rules that we discussed for the AED placements for infants and children. And listen what AED says. If rhythm is shockable, after clearing the patient shock, and then resume the CPR. After 1 shock, resume CPR immediately until prompted by the AED to allow the rhythm check about every 2 minutes. Continue until advanced life support providers take over or the victim starts to breathe, move, or otherwise react. If the AED detects a non-shockable rhythm, resume high-quality CPR until advanced life support providers take over or the child begins to breathe, move, or otherwise react. When we have 2 rescuers, you can see that almost all steps, especially the first and second and third, is always the same. Of course, when we have additional 1 rescuer, it is easier for us to take care of the child, of the infant, and the second rescuer will go and will activate emergency response, will find and bring and will attach the AED and pads, and then he will come and will help us during our CPR. First step is always check the safety. Second is to check the responsiveness. Again, first rescuer stays with the child, and second activates the emergency response system and gets the AED. Next action is based on whether breathing is normal and if a pulse is felt. If the victim is breathing normally and a pulse is felt, activate the emergency response system. Monitor the victim until emergency responders arrive. If the victim is not breathing normally but a pulse is felt, provide rescue breathing. Remember, we are talking about child or infant with one breath every 2 to 3 seconds or 20 to 30 per minute. Assess the pulse rate, no more than 10 seconds. Then check the heart rate. If it is less than 60 minutes with the sign of poor perfusion, we need to start CPR. If it is higher than 60, continue rescue breathing. Check for a pulse about every 2 minutes. If no pulse, start CPR. The first rescuer starts cycle of CPR with 30 compressions and 20 breaths. When the second rescuer returns, they continue the cycle of CPR with 15 compression and 2 breaths. Please remember, when we're talking about adult, we're going back. It doesn't matter how many rescuers you have, 1 or 2. You will do 30 to 2 ratio. For child and infant, if you have 1 rescuer, we will do 30-2 ratio. And when you have 2 and more rescuers, we will do 15 compressions and 2 breaths. Remember that for exam. We will follow all the rules that we discussed for correct chest compressions. And in the image, you can see how 2 providers, 2 rescuers, they are working together. When the second rescue returns, that rescuer gives breaths. They need to switch about every 2 minutes or earlier if needed, so that compressor fatigue does not reduce CPR quality. Use AED as soon as it is available. And as you can see in the image, they are using 2 thumb encircling technique for chest compression. If AED detects shockable rhythm, give a shock and then resume CPR. Continue CPR until advanced life support providers take over or the infant or baby begins to breathe, move, or otherwise react. And if we have non-shockable rhythm, again resume high-quality CPR and wait until advanced providers take over or the victim begins to breathe, move, or otherwise react.